Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please email us at map@oid.ok.gov, and we will respond as quickly as possible. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you very much. I hope everybody had a great weekend, and I hope you are seeing my screen that says welcome to Medicare Mondays. Rachel, if you could confirm that for me.
Yep, Ray, everybody can see it.
Awesome, thank you very much. So as Rachel said, a lot of times we'll take questions through the chat, but I have quite a few more slides for 30 minutes than I typically do. So please feel free to email those to that website that she gave you, and we will definitely respond to you, but I just didn't want to cut short what we're trying to share because this isn't much time to convey quite a bit of information. So most everybody is already aware we are funded by federal grants through the Administration for Community Living to help people in Oklahoma with all things related to Medicare. We've got 2 more events coming up this year before the end of the year. The one in November is going to focus specifically on the Medicare marketing guidelines. I do have a couple of slides in today's presentation that talk about this because I want to make sure that people have this information right out of the gate. As you know, we're past October 1st now, so the marketing hath begun. But I will go into more detail about that information in the November presentation. Then our last presentation for this year is going to be on December 4th, and that's going to be about the Medicare changes for 2024. And I've had some feedback from people who are like, wait a minute, why aren't we hearing about those now before we make our decisions? The changes that I'll be talking about in 2020, in that last event in December, they're not ones that are related to the choices that you're going to be making for open enrollment this year. These are just changes that are happening in the Medicare system for 2024. So let's go ahead and get started. As far as for 2024, we don't have a lot of new information yet for the Part A of Medicare. We don't know what the new premiums are going to be because most people get it premium free. Haven't really heard what the deductibles and things like that are going to be yet. We're hoping to hear about them pretty soon. Typically at this time of year, we haven't heard anything. This is not unusual for us not to know something at this point in time for Part A. I can tell you, and nothing's really changed about what Part A covers. I can tell you that there have been estimates that I've read that are saying that the Part B monthly premium is going to go up a little bit. They're estimating it's going to go up about $10 for next year. We don't really know what's going to happen in terms of the deductibles and stuff, but they are saying that they don't anticipate any major adjustments. So that's good news. Would have been nice if the Part B monthly premium had stayed the same, but at least it only is expected to go up about $10. Now, here's a chart that kind of shows, we talk about the Social Security cost of living increase. Haven't received word about that either. However, there are some estimates online if you read, and they're saying that it's going to go up about 3%, which is significantly less than what we saw last year Last year was 8.7%. The year before that, it was 5.9. Those were very unusual. We typically don't see big jumps like that as we did in those past 2 years. So it's going to be a much smaller, but more in line with what those increases have been in the past. Part B, benefit-wise, not really anything changing there. Now, let's talk about Part D prescription drug plans, because there have been some changes that we're going to see with those. We're going to see a couple of fewer plans in 2024. That information was released a few weeks ago. We had 24 plans in 2023. This year, we're going to have 22 plans that are going to be available. There was some consolidation amongst the plans. The monthly premium average in 2024 is going to be $55. The lowest premium is going to be a little bit lower. Last year, as you may know, our lowest monthly premium was $7.10. This year's lowest premium is going to be $6.30. Now, that plan may not be available everywhere. It may not cover everyone's prescription. So please don't go out there and just enroll in that $6.30 plan, because that might blow up in your face. You want to make sure that all of your prescription meds are on the plan that you select for 2024. The annual deductible is going up next year. It's going to be $545 in 2024. Now, keep in mind, several of the Part D drug plans have special circumstances where maybe all the Tier 1 and Tier 2 drugs on that Part D plan don't apply to the deductible. So in other words, you can get those immediately at your pharmacy at the discounted price without having to pay the full price and applying that to the deductible. In most cases, that's going to be like your Tier 1, your Tier 2 drugs, that layer where most of the medications are at. We don't, as far as the copay information, the formularies for those plans, all of that stuff is different, and it is now available on the Medicare Plan Finder. So if you call and talk to a counselor now, they can actually look at the information for 2024. There's a button on there now that says, look at 2024 plans, and you can identify which of the plans that cover your medications and at what amount. My recommendation to people is, I know people want to get enrolled and get it out of the way and be done with it for the coming year. We historically have seen where things change a little bit, where the prices might adjust. There have been many, many cases in the past where our counselors have talked to somebody early in the enrollment process, and the person wanted to think about it. And so when they came back and had made their decision about which plan they wanted to enroll in, lo and behold, when they did the comparison again, those prices had adjusted, and that can happen. So I strongly recommend that people go ahead and start learning and researching and stuff, but don't pull the trigger on your enrollment until a little bit later during the annual enrollment period, just to be a little bit safer. So, and then when you do, like for instance, if somebody is reviewing their drug coverage right now, when it does time for them to actually enroll, go ahead and rerun the comparison. Doesn't take that long, and make sure that the plan that you had initially identified as being the best choice for you is still that best choice. Because so many things can change, other than the prices, the contracted pharmacies, all of that good stuff. So we want to make sure you're going to get the best deal for the coming year. Enrolling in the Part D drug plans, this is the one thing that our staff and the other MAP counselors around the state, and we've got a slide at the end that tells you what agencies you can talk to, can actually enroll you in a Part D prescription drug plan. We're going to ask you for your medications. We're going to ask you what the dosage is on those meds and how often you take those medications. And we're going to put all of that information in the system, as well as the pharmacies that you want to use. And it will help us identify which plans are going to give you the best coverage where you live and provide it at the pharmacies that you want to see. And then that coverage would take effect January 1st. So it's really, really helpful if you've got all of that information with you and ready to go at the time that we're sitting down to counsel you. Now, Medicare Advantage plans in 2024. Few more of those than we saw on the Part D side. There's actually going to be 80 Medicare Advantage plans available for 2024, and that's actually a reduction from 2023. We saw a number of consolidations that occurred amongst the MA plan carriers. So fewer plans, however, according to the industry, according to CMS, 100% of Oklahomans have access to a Medicare Advantage plan, including MA plans with zero monthly premiums. Now, keep in mind, that is statistically speaking. That MA plan, even though it may have a zero monthly premium, it may not cover the providers that you want to see or the hospitals that you want to see. There's so many different moving parts to this enrollment process. I just want to urge you again, don't make your decision just based on zero premium or low monthly premium or something like that. Take the time to review the coverage. Make sure it's going to cover the things that you want to see covered. You'll notice on this slide that we talk about the average monthly premium being $17.34, which is a little bit higher than what it was last year. But so many of these plans are offering a zero monthly premium, and that's great as long as it gives you all the other coverage that you need at the providers that you need to see. The other benefits that can be available, like the dental and the hearing, vision, transportation, all of those things are really, really great, and they can be very helpful. But don't decide your health coverage just based on that information. Those can be really, really, really useful, such as transportation. If you're somebody that you can't have trouble getting to doctor's appointments and stuff, a plan that offers you that additional transportation could be really, really great as far as not having to find somebody that can take you and bring you back and all of that stuff. But make sure that the health coverage that it provides is going to give you the coverage that you need at the providers that you want to see. The other thing to keep in mind about the additional benefits, some of the additional benefits that are being offered by some of the plans this year may only be related to certain chronic illnesses. So when you're looking at those additional benefits, make sure that it's not a benefit. It's something that you're really interested in. Make sure that it's not something that's only going to apply to you if you've got diabetes or something like that. So what are the things that you want to consider if you're looking at a Medicare Advantage plan? One, make sure all those providers that you want to keep seeing are in network for that plan, because if not, you could wind up paying a whole lot of money. Even if you're on a preferred provider organization, which would at least cover part of those costs, that partial coverage could get pretty expensive if you have to see that provider on a frequent basis. So it's always a good idea to make sure that those providers that you know you're going to be seeing, cardiologists, pulmonologists, whoever your specialists are considered in network for that plan so that you can take advantage of those lower copays for seeing them. Some plans are now allowing people to see contracted partners in other states. So that would mean, let's say that you're on XYZ Advantage plan, and they have networks in other parts of the country, Kansas, Missouri, Colorado, Iowa, whatever the case may be. Those plans may allow you, if you're traveling, to see their contracted partners in those states, which is very useful if you're somebody that travels. So what I recommend is if you are somebody, one, you're considering getting Advantage plan, and two, you do travel, find out what that network is in that state. Maybe you've got family that lives in Idaho or something like that. Find out what the contracted network is there, and does that plan offer you that opportunity to see their contracted network in that state? Now, something to keep in mind is a health plan may have a contract with a well-known provider, let's say MD Anderson. Just because they have a contract with MD Anderson or the Mayo Clinic or the Cleveland Clinic or something like that does not mean that you automatically would get access to that provider. You still need to talk to somebody and understand clearly what the expectations would be if something were to occur, God forbid, and you needed to go to one of the, or you wanted to go to one of those providers. They may have a network provider who's local that they're going to require you to see first. So don't think just because they've got that advertised in their network that you would automatically have that ability. 2, decide if you're willing to follow the rules of that plan. That kind of relates to what we were just talking about. They are going to have rules about seeing in-network providers or getting prior authorizations for certain services and treatment plans and things like that. So you want to make sure that that's something you're comfortable with doing. Does the plan cover all your prescription medications? There have been cases where a person saw that 0 monthly premium for a Medicare Advantage plan, but they didn't bother to take the time to review and make sure that all their medications were covered, and it created a problem for them. So you still want to go through that process of making sure that all your medications for the coming year are on the formulary for that plan. So getting enrolled in a Medicare Advantage plan, our counselors can actually get you all the way up to the point to where you can, you know which plan you want to enroll in. However, in the state of Oklahoma, we cannot enroll you. You must go through a licensed insurance agent or enroll through the website on your own. So you would need to go through an insurance agent, and we always recommend that it's a good idea to look for a local insurance agent. If you enroll with someone over the telephone and it's someone you've never met, you don't know who they are, they're probably not in this state, chances are the next time you call back, you're not going to get that person. It's always good to have an agent that can kind of go to bat for you. If you've got a problem with your plan and you're needing someone to kind of be that advocate for you. So we encourage people, take advantage of those local agents. They're trained and they know what to do to help you out. Now, that was Medicare Supplement. I'm going to switch gears very quickly because I want to talk about a change that's happening with Medicare Supplement plans. Now, most of you are already aware of this, but for anyone who is not, Medicare Supplement policies don't follow the enrollment periods that apply to Medicare Advantage plans and Part D prescription drug plans. Medicare Supplement plans, you can enroll at any time of year as long as the company is willing to sell you a policy. The best time to enroll in a MedSup policy is during the 6-month period right after you start your Medicare Part B, because that's considered your Medigap open enrollment period, and you can get any policy that's sold. They can't charge you more, and they can't deny you because of any current or pre-existing health condition. Now, outside of that 6-month period, with very few exceptions, they can actually apply underwriting. They can look at your health history, and they may or may not offer you a policy. If they feel like you're too high of a risk, they can deny you a policy or charge you more because of that pre-existing health condition. And this has created some problems for some people because they did have health conditions. They were more or less kind of stuck in a policy, and the premiums kept going up, and they didn't want to leave their Medicare Supplement policy, but they didn't have many options. They really weren't interested in going to a Medicare Advantage plan. And so there were some barriers there for them. As of September 1st of this year, the Oklahoma Insurance Department passed a new rule. And here's what, I'm not going to read it from the screen, but here's what this rule states. It states that anyone who has a Medicare Supplement policy has the right to shop for and purchase another Medicare Supplement policy of equal or lesser benefits every year, and it's based on a 60-day period that starts with their birth date. So they have 60 days from their birthday to purchase a different Medicare Supplement policy of equal or lesser benefits. They cannot have gone for more than 90 days without Medicare Supplement coverage prior to their birth date. Okay, so let's say you've got somebody who's in a Plan F, and they've loved that Plan F, but now those premiums are getting awfully high. And so they're like, well, I wonder if I can get a Plan G for less money. Well, now they have that opportunity to shop for that plan. And if they can get a better deal, then they can move to that Plan G, that would be considered lesser benefits, and get a better deal and reduce those costs. So we're hoping that this is going to give those people an opportunity to, maybe reduce their Medicare supplement premium costs, as well as there are some people that just prefer using Medicare supplements. They don't really want to move to a Medicare Advantage plan, and that gives them this ability. Okay, want to talk very quickly about some changes that are taking place with the Inflation Reduction Act. Those changes actually started this year. This has been really great for a lot of people. The first one I want to mention is the insulin change. Anyone who is currently taking insulin started paying $35 a month for any insulin that they're taking. Now, the people who were injecting insulin that was covered by their Part D, which, you know, if that's how you're getting your insulin, is you're the one that's doing the injecting, they started out January 1st paying $35 a month for that insulin. For anyone who is using a insulin pump where the insulin is actually in the pump, that's covered by Part B as in boy. That started July 1 of this year. But now everybody is paying $35 a month for their insulin. So that's really great. The other thing that came about during 2023 was that any of the adult vaccinations that were covered by Part D as in dog, those were being offered at zero monthly premium. In the past, not zero monthly premium, zero copay. In the past, that copay was pretty high. Or let's say you got your shingles vaccine. That can be quite costly, and it's 2 shots. So now people can get their vaccinations that are covered by Part D, and they don't have to worry about a copay. Now, there are some vaccinations, as you know, that are covered by Part B as in boy. That's going to be the flu shot, pneumonia shot, the COVID vaccine, those kind of things. So you've still got some vaccines that are covered by one part or the other, but anything that's a Part D vaccine, there's no copay. Now, starting in 2024, we're going to see some other changes that are going to take place. One of those has to do with extra help, the low-income subsidy that helps low-income seniors pay for their monthly premium for their Part D drug plan, as well as lowering the copays they have for their medications. In the past, we had 2 categories on extra help. We had the people who received full extra help, which covered the full monthly premium as well as lowering those copays, that those people had to be at 135% or less of the federal poverty level. And then we had partial extra help, which was the individuals at 150% of the federal poverty level, or, you know, kind of between 135 and 150. Beginning in 2024, there's now going to be the one category, and now anybody that is at 150% or less of the federal poverty level will receive full extra help. So they'll receive, you know, their monthly premium will be paid up to a certain level, and it lowers their copays. We'll no longer have that partial extra help category, but this is actually going to be a big help. Now, for anyone who is currently on extra help, you don't have to do anything. If you're on partial extra help, you will automatically be transitioned to full extra help. So don't feel like you've got to go out and apply for anything else. But if you maybe didn't apply before and because you thought you wouldn't qualify, I encourage people. It doesn't hurt to apply. Lots of people can help you with the application process. Not only can we help you with that, but there's a group over at the Oklahoma Healthcare Authority that do this stuff all the time. And you can reach out to those people, their information, and darn it, I didn't put the slide on here, I bet. But you can contact us and we can give you their phone number. But they do this stuff. They're our partners on our MIPA grant, and we can both help you get that information. Now, hang on, I went backwards. The next one on the 2024, it eliminates the cost sharing when beneficiaries reach the catastrophic phase on their Part D drug plan. And that's going to make more sense on my next slide here in just a second, because I want to include in that the last change that's on our slide, and that's the one that's going to take place in 2025 when it caps the out-of-pocket costs for prescription medications for beneficiaries at $2,000 a year. Now, here's what that's going to look like. This is a slide from the Kaiser Family Foundation. And I hope you guys are able to see this. It is a little bit small. So in the first column, we've got 2023, current year, and it shows what things are now. You'll notice that orangey gold color, that represents what's coming out of the beneficiary's pocket. The blue is what's coming out of the Part D plan's pocket. The green is the drug manufacturer, and that dark blue, black color is Medicare. What we're going to focus on is that orangey gold color. When those amounts reach $3,100 in 2023, that's when the individual this year goes into the catastrophic phase, at which point in time they are coverage. And I don't know if you guys can see my cursor or not, but that's this. Beginning next year in 2024, the out-of-pocket, because that out-of-pocket threshold is going to go up a little bit. We know that it's going to go up to $7,000, or it's projected to go up to $7,750. That's in the footnote at the bottom of the slide here. Then the out-of-pocket max for those people is going to be $3,250, but they won't have that 5% in the catastrophic phase. It would be covered at 100%. In the last column here in 2025, you're going to see where you're going to have still have those orange amounts that you're going to have to pay in for your out-of-pocket costs. However, once that amount reaches $2,000, you're done for the year. You don't pay anything else for your medications until the following year, and the clock resets. So this is going to be a huge, huge benefit for a lot of our beneficiaries. So be ready. When we're talking about doing our enrollment process, one, you got to read your mail, folks. I wish I could tell you you could throw all those ads in the trash or in the shredder, use your shredders. But you need to read it because there could be an important notice in there that's from your current plan that's saying something about something that's going to change, or maybe the plan you're currently on isn't going to be offered next year. So take the time to read your mail. Get an accurate list of all of your prescriptions. All right. If you don't have like a Medicare.gov account, go to your pharmacy. They're happy to print you out that list because it's very important that you have an accurate list of the drugs, the dosage, and how often you're taking it. If you've got a Medicare.gov account, which is one of those accounts that you can go on there and set up yourself, if you want more information about that, we're happy to talk you through what that account is and what information it provides you. Have that username and password available with you because it will help our counselors help you more effectively. But I also want to make sure that you do not give that name and number out to anyone unless you absolutely 100% know you should trust that individual, because that's a lot of information you're passing on to someone you may not know that well. Now, you can trust our counselors, but be cautious about who you give that information to. And if you've got any questions about whether you should trust someone, give us a call. We'll tell you. Have your Medicare card or any other insurance cards handy. We need to know what your current coverage is. We don't want to do something that might accidentally mess up your other coverage. If you've got TRICARE or VA benefits, or you've got a retirement plan through the federal government or the state government, we need to know that information. So have those cards handy. If you have specific physicians and providers that you need to keep seeing, do your homework, talk to those providers. Find out if, say, hey, if I get enrolled in this Medicare Advantage plan, can I keep seeing you? Because you want to make sure you can keep seeing those providers. Very important. Now, there's been some changes with the marketing guidelines, and I know that we're almost out of time, but we may go over a few minutes. There's been some recent enhancements from CMS. The first thing they did, everybody has talked about the commercials on TV with Joe Namath and JJ Walker and all of this stuff. The challenge there was there were very limited things that CMS could do to those entities because those weren't actually agents. Those were third-party marketing organizations. And there really was no guidance to, establish what they could and could not do. Now CMS has corrected that, and it's much more stringent about what they can and cannot say on those ads. They also reinstated inclusion of the multi-language insert. So now when they put out some piece of marketing information, they have to include an insert that says that information can be provided in different languages. It also made some rules about the ID cards having to be standardized. The ID cards, while most of them contain pretty much the same components, it didn't really establish where those components would be at. And it made it easier so that counselors and beneficiaries could find that information. And also, they put on the websites, it's something that most people don't know is if you want someone to be able to talk to your insurance on your behalf, there has to be a document on file with either Medicare, well, actually Medicare and your Medicare Advantage plan or MedSup plan or anyone like that, that states that you as a beneficiary are giving this person permission to speak on your behalf. It doesn't matter if that person has a power of attorney or anything like that. This document has to be on file. So they're requiring that they put on their website how this person can gain access to that document and get it turned in. Now, there's also a requirement that beneficiaries have to have the ability to opt out of any future contact with the health plan, including the plan that they're enrolled in. Currently, if you're enrolled in a Medicare Advantage plan, they're able to continue contacting you about other products and things like that. This new rule is saying you've got the ability to opt out in writing if you don't want to have that contact about anything other than the plan you're enrolled with them for. It explains the effects of an enrollment choice on your current coverage. Many times, if you're one of the counselors that's on the call with us, you've had people say, well, I didn't realize it was going to change this, or I didn't know that that was going to mess with my retirement plan. Now there's a requirement for that explanation. It clarifies the prohibition on unsolicited door-to-door contact without an appointment. Even if they've had, and we unfortunately can't get into the marketing guidelines too deeply in here, but there was some gray area about if they turned a business reply card that an agent could just show up. Agents can't do that. There has to have been a pre-established appointment of the date and time, and they have to set what's called the scope of the appointment. They have to state, this is the product or products that we will talk about at that appointment. There has to have been if you go to an education meeting, which is where you learn about, say, a Medicare Advantage plan, they cannot have a marketing event on that in the same location within 12 hours of that education event. And furthermore, if you go to one of those education events and you decide, well, you know what, I'd like to learn more about this product, I think I would like to make an appointment, they can do so at that time, but it has to be at least 48 hours after that event. Now, there are assistance programs available, and unfortunately, I'm a couple of minutes over, but I just want you to know, if for any reason you're having trouble affording your prescriptions or your premiums for your Medicare or anything like that, try and learn what those options are that can help you with those costs. We don't want anyone that's going without insurance if they don't have to. Let us help you identify what's going to work best for you. Now, I told you before, I wanted you to be aware of our partners that are out there that do this same kind of counseling during open enrollment. These are the agencies around the state that we contract with, and I've got the counties that they serve in there as well. People are always welcome to call our office. Our number is 1-800-763-2828, and we help everybody across the state. Now, if you know someone who's in another state who is looking to get enrolled in a plan or they're needing some counseling, there's a program like ours in every state. And you can go to a website that is shiphelp.org. So it's shiphelp.org. And there's a place where you can identify the organization like ours in another state. So these are the agencies we work with. If you're looking for assistance with low-income programs and stuff, please reach out to us or reach out to the folks over at Oklahoma Human Services. They're on their website. If you go to Oklahoma Human Services, look for, okay, here we go again, Medicare and Money, or Money and Medicare. You'll find it, all right? It's a great program, great counselors. Please take advantage of that. So that is it for our presentation. I really do apologize that hang on just a second. I'm trying to get out of this. I guess I'm not going to be able to. Thank you guys for joining us. Don't forget, join us next week and we'll be talking specifically about those marketing guidelines. In the meantime, read your mail, look at what's being offered to you, find out, ask questions. And beginning October 15th, that's when you can actually start the enrollment process. So take advantage of that. Appreciate you guys and look forward to seeing you next month.